This bill is pretty simple. It basically requires that hospitals allow a qualified patient with a terminal condition to utilize medical cannabis in an institutional setting, so nursing home, hospital, hospice care center. Now, the story behind it was compelling to me, and so I want to share it with you, sir. Ryan was a teacher, a Coast Guard veteran, lived in Shoreline, and was a man in his 40s. He was diagnosed with pancreatic cancer at stage 4. It was 7 weeks from his diagnosis to his untimely death. And he had an experience in 2 different hospitals, and they were very different. So the first hospital utilized standard care. It was fentanyl as a sedation medication to keep him comfortable. But this left him groggy and unable to really connect with the people, his friends and family who were coming to visit with him. And his father, Jim Bartell, knew folks in the cannabis industry who could create a tincture that would help him with pain medication but still maintain alert awareness. When they asked the hospital if they could utilize it, the hospital said no. So Jim went to work and he found a different hospital in the state who was willing to do that. The experience in this second hospital was much different. Ryan was able to live out his days in comfort, dignity, and able to connect with those family members and friends who were saying their last goodbyes. Mr. Speaker, if you've ever had the opportunity to have what you know is the last conversation you will have with a person, you know how important it was that he was able to feel this way. So, inspired by this father, Jim Bartell, inspired by his experience, worked very hard in California, where he lives, to pass this law and called it Ryan's Law. And he brought the idea to me over the summer, and I could see the value in it, particularly as a state that has a very well-established medical cannabis system. So basically this allows for uniformity across hospitals. It balances the needs of hospitals for safe storage, for any of the needs that they have. And it balances that with the patient's ability to try something maybe outside of standard pharmacological treatment in order to have the kind of comfort and dignity at the end of their life that they deserve. So I hope that you will join me in voting yes for this bill. Thank you.